At this point, I want to turn the program back to Jim Battles, who's going to talk a little bit more about the federal resources and tools, as well as a continuing discussion from some of those that are in the trenches of reducing these infections at the hospital level. So, Jim?
Thank you very much, Don. Next slide, please. One of the things that we're doing at ARC is to expand what we've done with CUS that I talked about earlier to other HAIs and other hospital-associated conditions, namely what we're doing with catheter-associated urinary infections, ventilator-associated pneumonia, surgical site infections, and perinatal safety. Excuse me. Next slide, please. Our first major and probably most important initiative is the expansion of CUSP for CAUTI. We are using the same state-based structure and expanding our CUSP activities to include CAUTI. We just completed a pilot test of the CUSP for CAUTI in 10 states with 10 hospitals in each state. We are now expanding that effort nationwide, and this expansion began yesterday with the effective date of the contract to move CUSP for CAUTI on a national level. And that project is also with the same team that are bringing you the CLABSI activities. And this activity is known as On the Cusp, Stop HAI. So stay tuned, and recruiting is beginning now. Next slide. The next logical move is to develop the resources and materials for CUSP for VAP. We will be initiating a contract for the development of that. There will be a 3-state pilot, and we will begin national implementation of CUSP for VAP in fiscal year 13. Next slide, please. The third area is working on a version of CUSP called Surgical Unit Safety Program, or SUSP, which will focus on SSIs as well as other surgical complications. With a unit-based approach, we wanted not to just separate the surgical site infections, but deal with all surgical complications simultaneously. It builds on the lessons that we learned for CUSP with HAIs, incorporates the WHO checklist, involves our teamwork with team steps, safety culture, and learning from defects. The SUSP project begins on September 1st of 2001. Next slide, please. The next major focus of applying a sort of CUSP focus really isn't an HAI, but rather a major HAC, and that's our Perinatal Safety Improvement Project. Birth injuries and obstetrical adverse events are really severe and important events, and are one of the 9 primary HACs that are part of the Partnership for Patients. ARC is building on its evidence in labor and delivery to initiate the Perinatal Safety Improvement Program, or PISP. Also, this will begin in September. Next slide. The components of PISP include, again, culture of safety, teamwork with team steps, and a heavy focus on what is being known as in situ simulation, where you actually take simulators right into the labor and delivery room. Checklists, again, sense making and learning from other defects.